Hi guys, Dr. Ben Schurhamer here. Just a quick video here just to coach you through looking at your multiparametric of the MRI prostate report. So we appreciate you getting that, and this is just a few things to help you process that. So I think first thing for you to know is that a lot of work goes in behind the scenes of interpreting your MRI. And so this is just a quick schematic of some of the results that will come back in. Hundreds of images of your prostate are processed by the radiologist, and they look at it under different phases with the magnet, with and without contrast, and so on and so forth. And so lots of work goes into your report. When you get your report, you will likely be able to access it through the electronic medical record, and you will see that generally on top they will have the impression, and so the impression is the area that you're most interested in. There is probably lots of technical information between what you're looking for and the impression, and so I would likely just ignore most of that because that's mostly for other radiologists. So the impression will generally have three different things. So it will have the PIRADS score, it will have tumor bulging, and then it will have the prostate size. The PIRADS scores is what we are most interested in if your MRI was obtained for prostate cancer screening or follow-up. And so that PIRADS score will be anywhere on a scale of 1 to 5, and then may give some regions of the prostate that will be pertinent later on. The second part is just would show if there was any sort of extraprostatic extension or spread of the prostate locally. And then the third part is the size, which I've actually taken out here. So three general things that we're looking at in the report. So the PIRADS scale is actually an international scale that lets any radiologist figure out what is going on with your prostate on a standardized scale. So you could go to any hospital in the country, and likely they would use just about the same scoring for your prostate. And so from the urology perspective, we are most interested in finding patients with PIRADS 3, 4, and 5 lesions. And then you might wonder, well, what about lesions 1 and 2? And so what we found over time is that PIRADS 3, 4, and 5 lesions have an increased risk of prostate cancer, and PIRADS 0, 1, and 2 lesions show really no change in their prostate cancer risk. And so if you come into clinic, I would tell you that if you have a PIRADS 3 lesion, it's about a 20% risk. PIRADS 4 is about 50% risk. PIRADS 5 is about an 80% risk of on subsequent biopsy finding some degree of clinically significant cancer. PIRADS 0 to 2, basically no change in the risk above just the standard population. If we have a PIRADS 3, 4, or 5 lesion that we see, what we generally do is actually perform a fusion biopsy where we actually fuse the image from the MRI with the ultrasound in the procedure room, and put those images together to obtain specific cores down to the millimeter so we can target what was seen on the MRI. So you may be wondering, well, if I had a negative MRI, is there any chance left that I could possibly have prostate cancer? And unfortunately, the MRI test is not perfect. We find that the MRI picks up on 80 to 85% of clinically significant disease, and then misses maybe about 10 to 15%. And so what we do find is that so this study just shows that, over time, with continued surveillance and monitoring, there is about a 69% chance over the years of finding other disease that was potentially missed on the multiparametric MRI. So what are the next steps? Well, if you have first, communicate with your team and help us make a shared decision together. Likely the next steps will be to either come into clinic and discuss the next steps with us. We could move forward with a fusion biopsy. We could choose to observe, given the different PIRADS scores, or this could, help us rule some things out. And so, make sure to reach out to your urology team, and hopefully this video will help you to arrive to a decision sooner. Thanks again.